If somebody told you that you're stuck with your scar, that there's nothing you can do, they are totally wrong. I'm a dermatologist. I see patients with scars on a daily basis. I remove skin cancer, that of course leads to scars. We see scars from dog bites, all sorts of things. And what I tell my patients is that most scars are at least 60 to 70% improvable with the right strategy. And in order to establish the right strategy, you have to know what type of scar you have. So it's not about having a certain device. It's about knowing what scar you have and treating it with an appropriate plan. I'm Dr. Morgana Colombo, board certified dermatologist, founder of Vida Derma, a science-based skincare line aimed at helping women as they age. And I am here to educate you on scars and tell you what you can do to improve them so that they don't, ruin your life and keep you upset because you have those things on you. So when you have trauma to your skin, your body as a healing response will lay down collagen, remodel collagen in order to heal. The issue is that collagen remodeling usually is not in the same smooth, organized pattern that you had originally. So that's how you end up with scars. Sometimes there's loss of collagen. You can have an indented or atrophic scar. Sometimes your body produces too much collagen. That's when you have your hypertrophic scar or keloid. And then the other issue that can happen with scars is due to, dilation of blood vessels, release of melanin or pigment cells. You can have scars that can be like pigmented, red, or even white. So I wanted to put the scars in categories so we can talk about them. So you have your atrophic scars, your hypertrophic scars, your keloids, which are exaggerated hypertrophic scars. And then you have, when it comes to color, your erythematous or pink scars, you have your hyperpigmented or brown scars, and then you have your white scars. So I'm going to get into all those different kinds of scars and how you can improve them. The kind of scar that you have does matter to how you're going to address. So we talked about the different kinds of scars, which is our important starting point: atrophic or indented, hypertrophic or raised, and then the discolorations: red, brown, or white. So we're going to start talking about the different textures of scars, atrophic versus hypertrophic. I'm going to first start with atrophic scars, your indented scars. So we see atrophic scars as a result of like acne, surgical procedures, cut, dog bites, all sorts of things can lead to those indented scars where there's loss of collagen inside the skin. So how do you address those scars? Number one thing with any scar, let's talk about prevention. So when it comes to preventing atrophic scars, think about like if you have acne, you want to treat your acne. If you appropriately with pills, even Accutane if you have to, because if you don't treat the original lesions, they're going to lead to those scars. It's more complicated later, but so prevention. When it comes to surgeries, even in that setting, there's a way to prevent the chance of developing an atrophic scar. So you want to go to somebody who's skilled with what they do. And a lot of times when we actually excise the skin cancers and different things from the skin, we invert the scars so they're like slightly raised so that as your body heals and scars flatten out, they don't indent, they end up flat. So getting a good skilled provider is really key if you're going to go for any kind of surgery. Okay. So that's our prevention. Now let's talk about how do you treat a scar if you have like an indented scar. So the first thing I'm going to talk about is topical treatments. The first cream to try in the setting of any fresh scar is a silicone gel. So if you have like a new cut or you had an excision of some sort, Once the initial healing is done, which is usually like 1 to 2 weeks, you can start putting your silicone gel. Usually at night for 3 months is what I recommend. And that tends to keep the scars flat and, it helps with indentations or even, prevents them from getting raised. So silicone gel. Number 2, once your scars are a few months old, maybe like 2 or 3, that's when I incorporate the retinol, either over the counter or prescription. Our Vidaderma Reverser is potent like a prescription, but non-irritating. So great for people that have more sensitive skin. You want to do it every other night with a moisturizer, or prescription tretinoin is very beneficial. Again, every other night with a moisturizer. So that's your topical treatments that we do for atrophic scars. Second, let's talk about what you can do in office to address atrophic scars. If you have an indented scar related to like steroid injections, we actually inject saline to get rid of the indentations. Multiple treatments every 2 to 4 weeks. It does work. Okay. Other types of like indentation, the saline does not tend to work as well. In that case, if needed, will inject filler, hyaluronic filler, or sometimes biostimulators such as Radiesse or Sculptra. It varies. So you have to come to somebody who knows what they're doing, so they're going to judge. And we also do treatments. So treatments to promote collagen to kind of puff out the scar. So RF microneedling is one. The heat promotes collagen. And then your fractional lasers, fractional CO2 and fractional erbium, aka ultra clear. Those are my favorite ones. Typically we hit the scars with like deep settings to promote collagen. The Fraxo, which is a non-ablative laser, can be somewhat helpful also. So again, prevent formation of scars with proper technique when you're having surgeries or, treating your acne. And, the other thing I mentioned is, of course, anytime you have any kind of like surgery or procedure, you always want to decrease tension on that area as much as possible, because that does allow for better healing. So that's prevention. Number 2 is your topicals that can be used. Tretinoin, retinol being like the number 1. And then number 3 and 4, your injectables. Saline for steroid indented scars. Fillers such as hyaluronic or biostimulators for your other kinds of like indented scars. And devices. Fractional CO2, ultra clear, RF microneedling, multiple treatments repeated every 2 months. If you combine all those things, you can significantly see improvement in your atrophic scars. Next, let's talk about the scars that I feel like bother people the most. Your raised or hypertrophic scars. If severely raised, we call them keloids. So again, just like the atrophic ones, first thing is prevention. So if you know you're prone to keloids or hypertrophic scars, you have to let your surgeon, and if you're going to have a procedure, know, so they can inject steroid right after the procedure or 2 to 4 weeks later to prevent that. Especially important in the case of like C-section scars, tummy tuck scars. So steroid injections right like around the procedure really helps. The other thing is certain areas are just more prone to hypertrophic scars or keloids, areas of like higher tension. So if you're somebody who's prone to those, unless you really need to, avoid unnecessary procedures in areas like your chest, your back, because those are areas of high tension. They're going to give you a higher chance of developing a hypertrophic scar. And if you're prone to keloids, don't go and put like a bunch of like rings on your ears, because you're just going to get, keloids. And you're going to have to lose the ring anyway, or your nose, so prevention. Okay. And then, the last prevention thing I'll mention is if you have an excision or removal of something and you are prone to those hypertrophic scars or keloids, and that, keep your activity minimal for the first month to decrease tension on those scars and improve your healing. Okay. So 2, let's talk about treatments. First, we're going to, just like the atrophic ones, talk about topicals. It's the same stuff. Early on, you want to do your silicone gel every night. I'd say every night for 3 months. And that on a lot of people can help prevent the incidence of hypertrophic scars. Once you have the scars and they're already raised, the silicone doesn't do a whole lot in my opinion. At that point, I prefer topical steroids for body parts, stronger ones. Some of them even come as a tape. There's a tape called Cordran's, a steroid tape that helps. And again, your retinol, over the counter, or tretinoin. So those are going to be your topical treatments for raised scars. And then 3 are going to be your in-office procedures that can be really helpful. First thing we do when we see raised scars is we inject them with steroids. That can be tricky if done by somebody who's not experienced, because you have to know if you're going to inject something mild, moderate, or in a stronger strength of like steroid. If you inject too much, you can create a significantly atrophic scar that can be even more disturbing cosmetically than the raised scar. So, and then if you don't inject strong enough, you just don't get results. Sometimes the scars are so raised that we have to combine the steroids with Fluorosil. Again, go to somebody who knows what they're doing, but the injections are helpful, and is serial injections. We do multiple injections. It could be for some person 2 injections. It could be 10 injections. It just depends. So that's injections in the office. On top of the injections, we also do devices. Again, your fractional CO2, ultra clear, which is erbium, microneedling with radio frequency. Those can help pack in that collagen and make the scar flatter. It's the combination that really gives results, and multiple treatments. So patience is really key. So we talked about, the texture of scars, atrophic, hypertrophic. Now we're going to get into discoloration, which is a major issue with scars when it comes to how it bothers people. So when it comes to discoloration, we typically tend to see scars that stay pink for a long time. They're erythematous, scars that turn dark, hyperpigmented, and scars that turn white. So I'm going to talk about the 3 kinds. With your pink scars, the number one thing is, I'm going to be honest, time. Over time, they tend to just eventually lose that red discoloration. Those are very common in very fair-skinned people. Some people, that pinkness stays for so long that it really bothers them. In that case, the treatment of choice is a vascular laser. I tend to favor the pulse dye laser, and usually multiple treatments. We go every 6 to 8 weeks for 3 to 5 treatments to decrease discoloration. We start with slightly bruising settings, which means with the pulse dye laser, the VBeam, you're maybe initially at like 3 milliseconds, and we keep dropping the milliseconds, 1.5 to even 0.5 to, really help with the redness on scars. Tretinoin is the one cream that really helps all scars, that I always recommend. And of course, sunscreen. If you get sun on your pink scar, it's going to get pinker. So you want to protect it from the sun with sunscreen or clothing every day. Okay, so those are your pink scars. Now let's talk about your hyperpigmented or brown scars. So those can be treated with a few things. One is to decrease the chance that something turns dark. Sometimes if you start that tretinoin early on, that works. On people that are really prone to discoloration, sometimes I'll even give them a mild amount of like a hydroquinone bleach in the beginning. After some sort of like injury to prevent the dark scar. But if you have that dark scar, to treat it, again, time erases everything. But for some people, time just takes forever. So they don't want to wait. So in that case, again, that tretinoin, helpful with all kinds of like scars for color and texture, like I said before. But with hyperpigmented scars, we do discoloration agents. So sometimes we'll combine hydroquinone with kojic acid, tranexamic acid, a mild steroid. So those lightning ingredients can really help discoloration over time. And again, sunscreen. Sun will make your scars pinker and darker. So definitely sunscreen every day or cover up your scars. Okay. When it comes to devices for dark scars, my favorite laser is the Pico at the 1064 nanometer wavelength. It works really well. But it's more expensive, and again, multiple treatments. So that's your discolored scars. And then lastly, I'm going to talk about the white scars. Those are the toughest ones. Some of them, that's the one category that I'm going to say we can't necessarily give you that 70% improvement that I talked about initially. What we do for white scars is creams. We do anti-inflammatory creams such as Opsilura, tacrolimus, pimecrolimus. They help a little bit. We also do topical Latisse, the eyelash thing. Yeah. So we actually, in my office, use it more for the white scars than for the eyelashes. So that can induce some repigmentation. And a lot of times I'll do Latisse in the morning and then the anti-inflammatory agent at night. And again, your tretinoin works for everything, or retinol. When it comes to devices, there's no device that 100% really helps. There are a few things that can be tried. There is this device that shoots, UVB light on your skin. It's called the extract device. That sometimes can be helpful. We use it for vitiligo. Sometimes it can help with white scars also. And then the other thing we do is we use devices just to open up the skin so the Latisse can penetrate better and hopefully give you better results. So for that, it would be your fractional devices such as fractional CO2, ultra clear, Fraxel. So that's kind of like our approach for white scars. So I went into this whole talk here about different kinds of scars and how to prevent and improve them. So that is the key thing when it comes to scars. Most scars are improvable if you're patient and willing to address it with a multimodality way. Number one thing is always prevention of, worse scars. And that involves surgical technique or, sunscreen, decreasing tension on scars, those kind of things. So always, if you're going to have a procedure or if you have acne treated, so always think about prevention first when it comes to scars. Number two, if you have a scar or you already did your preventive stuff, now let's talk about treatment. And treatment varies based on the different scars that you have. We subdivide scars into textural issues, atrophic, hypertrophic, and color, red, pigmented, and white. And we combine different things to sort of address all those things. And typically we're talking about topical treatments, in-office procedures, and multiple treatments combined. So that's my spiel, guys, on scars. So they are definitely treatable. You're not stuck with your scars. If you need like a surgical procedure for something important, don't worry about your scars. Come to us, dermatologists. We can 100% help you. I've done that for a lot of people. If you have like a horrible dog bite scar, come to me. I'm willing to help. I've helped a lot of people. You are not stuck with them. If you treat them appropriately, like I just mentioned in this whole video, you have a 60 to 70% chance of improvement. That's pretty high. At that number, the scars are so subtle that they don't even bother people. All right. So thanks for watching me. If you love the content that we talked about, please make sure to subscribe to my channel so I can keep producing more videos and keep educating you.